When we're thinking about evaluating a service, our starting point is that services will usually be beneficial and can improve the outcomes of people who were experiencing homelessness. However, in some cases, despite the best efforts and our best intentions, some services might not be as effective as we were hoping they would be. And this is a point in which evaluation can be a really helpful tool. Evaluation can help us to identify which are those services that are really helping us improve the outcomes of people who are experiencing homelessness, and as a consequence, making the investments so that those services expand and are scaled out across the country. But also in those cases where the evaluation might turn out to identify some areas for improvement, it can also become a tool to help us refine those services and make sure that as a consequence, they can deliver the outcomes that they were hoping to deliver. The really important point is that evaluation is a means towards an end. It's really about making sure that all of the services that are occurring are really effective at helping people who are experiencing homelessness. When we're thinking about evaluating services, it's usually easier if we're focusing on the evaluation of a new service. Basically, thinking proactively about what are the elements of the service that we want to consider and really thinking about how can we embed evaluation and data collection throughout the whole service makes evaluation so we can conduct them much more effective, but also that we can adapt to some of the characteristics and some of the specific aspects of these services. When we're thinking about evaluation, thinking about a control group is a really important part of making sure that the evaluations are effective and that they're clear. So maybe an example can be helpful in this particular case. So imagine that we're trying to introduce a program that offers a cash transfer to people who were experiencing homelessness. And we're really interested in looking at what's the impact that that has on their mental health. The problem is that over time, people change because of natural reasons. Natural changes really occur. In some cases, people's mental health might deteriorate, while in other cases, their mental health can also improve simply because of the way life is. If we are really interested in understanding what's the impact that this cash transfer had on someone's mental health, we need to account for that natural change. So by creating a control group, what we're basically doing is making sure that we have someone else, another group that can help us almost mimic what's a natural change that would have happened in the absence of that cash transfer. So the power of the control group is that it helps us isolate the natural change that people have over time with the potential impact that the cash transfer might have in this particular group. The really important thing in a randomized control trial, and the reason why they're so powerful, is because the way in which we create the control and the intervention group is by randomizing. That ensures that the two groups are identical in every way, except the fact that one of those groups received the cash transfer. So, as a consequence, we're really accounting for the natural change in a way that is really effective. When we are doing randomized control trials, it's really important to think about the ethics of giving a service to one group and not giving the service to the other group, that in this case is a control. There are ways in which randomization can be done ethically, and we take those reasons really seriously in all of these evaluations. These include, for example, cases where we might have limited capacity to deliver to everyone. In those cases, randomizing access could actually be a fair way of allocating scarce resources between two groups that otherwise would be eligible for that service. Another example is that in many cases, and this is a case in most homelessness services, we don't know how effective this service is. And as a consequence, randomizing people into receiving the service and not receiving it's ethical because it's a mechanism to help us find out whether this service is really helping. Most importantly, in all of the projects, people already receive a good level of care. Really importantly, services are always offered on top of what people were already eligible for. And taking part in a trial would never mean that someone stops receiving a service that they were already receiving. So these two reasons make sure that people continue to receive the support that they were entitled to, and now a new opportunity arises as well, and that's the one that we're exploiting for the evaluation. The other thing that is important is, of course, all of these evaluations abide by the highest ethical standards, and that includes things like making sure that people are informed of what they're taking part, that they know how their data is being used, that they know about their rights and the potential that they have to remove themselves from an evaluation if they consider that that is appropriate. But also, all of these projects have undergone through a really strict process of ethical review to make sure that we're complying to those requirements and making sure that people safeguarding is of utmost importance. For all projects, we're making sure that we abide by the highest ethical standards. Every single one of them has undergone an independent ethical review to make sure that we're considering all of the relevant aspects in their design. But also, we have two additional mechanisms to support us throughout the design and the delivery of all of these projects. On the one hand, we have a group of expert advisors that include academics, practitioners, and people from local authorities. And on the other hand, we also have a group of people who have personal experiences of homelessness to advise throughout the whole project.